We believe that in order to design really good services in health and care, you've got to have the people using those services in the room, and their voices need to be heard as part of this process.
It's important to allow patients and health and care professionals stroke leaders to step away from their established roles.
Absolutely.
Because of the there's a real otherwise people show up into the room and it's so easy to have those roles at the back of your mind.
I like to introduce opportunities for people to move about the room, not only to talk to different people, but to see things from different perspectives, and also to physically move a bit, to stretch a bit. We know how bad it is sitting down all of the time, and yet in workshops quite often that's what we do. So I like to mix things up a bit and get people standing up, moving about. A community-led health project up in Cumbria, wanting to get people talking about their health and well-being in the community. Instead of having a health check day, had a day which they called, using some sort of local language, how's your fettle? So people, when you talk about fettling, making things right, and so the sort of drop-in sessions were called how's your fettle? And I thought that was a really nice way of not using the health word and getting people to think, oh, what's that about? And it being in a kind of language that meant something in that specific bit.
Part of the challenge we'll often bring is dilemmas that leaders are faced with this work. Hold on. This is either about building relationships or it's about achieving the task. We can't do both. Well, hang on, we want to challenge that assumption. So by building in small pieces of reflective time and modelling reflective conversations, we can show people how time and space can be built into a day when they didn't think they could have it. They thought they had to focus on the task. And by actually building in that time to just have a little bit of reflection, it absolutely transforms the quality of their work. It's a cliche, isn't it? But be the change you want to see. So that's also being very conscious of what it is you want to have happen and really consciously be aware of doing that.
Yeah.